Mallet finger injuries can be some of the hardest injuries that you treat as a hand therapist. Now, a mallet finger is that terminal tendon rupture. Basically, a lot of times when they get jammed or something like that, and it ruptures that tendon. I have one that's a mallet finger and it's on the small finger. So it's even smaller than the small tendon, right? I have one that's a small finger and then one that's a bony mallet, meaning when she fell and she hit her finger, she has a small fracture along with the disruption. She actually had a pinning surgery. So here's a little video that I did with one of my patients who has a mallet injury to the small finger. My name is Huang. I'm an occupational therapist and certified hand therapist, and inside the mentorship program, I share cases like this with my patients and discuss like what you could do in order to be able to think through your case and then provide the best possible treatment and solution for your patients. If you're looking for more help and more guidance with your cases, click the link below to see more about what the mentorship program is about. I know what you're thinking. Oh, you just need 4 to 6 weeks. Listen to what I have to say about this one. So the most important thing about the mallet finger, right, is look, not everyone's the same. You are very hypermobile. You see that? Like me too, right? So what we want is, because we know you're very hypermobile, you don't stiffen like everyone else. Like if you read it and they're like, oh, you stiffen between 4 and 6 weeks, because you're so loose jointed, you need more time, right? So I would almost go 8 weeks with you before I mess around, right? So the best thing about this splint, right, that I think is gonna be now better than the cast that we started with, is that you can wear it, you can wash your hand, and you don't have to take it off. The cast that you had, you couldn't get it wet, right? With this one, you can get it wet, you just wash it, just dry it, just kind of like shimmy it a little bit to let it dry, right? Now you don't want at any point for it to fall down, right? So when you take it off, you have to take your thumb and hold it like this. So take your thumb with your other hand, like this one, like this, hold it like that. So you almost like have to, yeah, there you go. You almost have to bend the knuckle and then hold it like, oh, you're so loosey-goosey. Oh my gosh, just don't take it off.
Well, this pinky is also kind of...
It's wonky too? Yeah. Okay, try it with this one.
That one's
there you go. Right, so try it with this one now. All right, so yeah, if you have to take it off, I'm gonna practice with you on this one. All right, let me get one that fits this one. So let's say it's this. All right, okay, right? So if you were to take it off or to just shimmy it, like you could, so you want to make sure that the bar is down here, because then you cannot bend it. This is loose on me, obviously. Right? Yeah, let me get one that is this size. Okay. Oh my God. Yeah. Right. So if you were to shimmy it off, like try it on this one, right? Try it with this one. You can turn it a little bit. See how you can turn it and just let it dry?
Oh yeah.
Let it dry and then put it back. This is a little tight on me. You actually want it to be tight, but if you were to take it off, you have to make sure that you take it off without it going down. Yep, just like that, right? And then when you slide it on, you have to make sure that when you slide it on, it doesn't, yeah. All right, there you go. Yep, just like that. Boom, right? There you go, just like that. Key thing is just don't take it off, right? Obviously, if it starts to shimmy off, or you just want to air it out just a little bit, you can twist it. You can just do a little turn, just take it off a little turn, just keep it straight. For you, I would just keep it on for another 4 weeks. All right. Now, you can get this type of tape anywhere. This is called transport tape. You can get it at the drugstore. It's just a clear tape, and what's great about it is it's easy to come off. Like just right? And so let's say you're taking it off. You can put it on, you can slide it off, right? You actually are fine as long as you don't bend it. So if you were like this and you slid it off, you see it doesn't move. That's why I was testing. That's what I was testing when I was sliding it off, and I was like, let me put it in what we call a straight position. This is called a straight fist, right? So if I were to slide it off, I'm gonna just show it with this one, right? So put your finger like that. If you were to slide it off, you would keep your hand down like this, and you see that? Okay. Then you wanna put this piece of tape, right? And then that tape will hold you. It doesn't hold everybody, but it's gonna hold you. That's what I was testing. It would hold you because you're very loose jointed. I have someone else who's like real stiff with a mallet, and it's different for her, right? But for you, you could use this tape, right? And you see how it'll straighten you up?
Yeah.
And it'll keep you straight, so you won't mess up that like reattachment, right? This is all to help avoid having a surgery. If they do the surgery, they would pin you and you'd wait another 8 weeks. That's the shit of a mallet finger. You can't help it. It's just, it's got the smallest little tendon. That one tendon is made of 3 little strings. And that's what they call the terminal tendon. That's the one you tore, right? For you, we're trying to avoid it because someone who's as hypermobile as you are would develop a swan neck. Because that's what I'm working with right now, someone who has it and it's already developed it, because she's very loose jointed, hypermobile as well. So you're very hypermobile, right? So, but yeah, so you want to put, if you have to take this off for whatever reason, it's irritated, it's, your skin, or you just have to take it off for a minute to wash it, it got dirty, it got nasty or whatever, just take it off and put it, right? And then, I'm just gonna leave this tape here on this finger, and then if it gets nasty, you just take it off, right? And you can put another piece, and it's just gonna ensure if one or the other. But you want something hard. This tape is not gonna last. It only lasts for like a little while, right? But it's gonna get cruddy. So, you want me to take it off? I can take it off. I might take it off. I'm using my.
Can the tape get wet or no?
No, I mean, it's gonna get wet, it's gonna get gross, right? So here we go. So relax your finger, right? It is, right? There we go. Remove all this. So I'm gonna take the tape off. Keep your finger straight, right? Slide this on. You're so loosey-goosey. You're so loose jointed. Does that hurt?
No.
Alright. So only exercise you're going to do is squeeze and then relax. Yeah, still stay straight. Squeeze and then relax. Squeeze. Do you have a phone?
Yeah.
I'm using mine, so. Right, there you go. Put your hand like this, right, and then squeeze it. Now you have feedback into that, right? You feel how tight you can be, right? And then relax, right? And then squeeze. Yep. So we need to stiffen this even further, but we're going to strengthen this one to come down so it doesn't pull on this one, right? And then squeeze.
I'm doing a voiceover right now, but I just want to show you that I'm still doing the exercises. I'm trying on different splints. I'm trying different sizes, and I want to give him something that he can continue to use because I'm not going to see him for about 3 to 4 weeks because I want him to continue wearing it. So all this is a part of the therapy session. This is what people are coming to you for as a hand therapist in your area, as the hand expert. So these things are just as important as the doing that sometimes we get stuck on, right? So I didn't want to just cut it out because it's a little repetitive and boring. But anyway, hope that helps.
Don't lose it. Yeah, just don't lose it. And the reason why I like this, I can make you a splint as well. It's not as breathable as this one, right? So I just want you to wear it. Just keep wearing it.
In this video, I decided after using a cast for a little bit, I decided to go with an oval 8 or a figure 8. And one of the reasons why I did that, and I use a prefab over a custom fitted one, because you can do either one. I was just looking for something that was going to be low profile for him and something that he can wash his hands. There used to be this material that it looked like this little mesh, but you could use a heater to heat it up and it would give you the same feel as a cast, only it was like you could wash your hands and stuff like that. Well, they no longer make that, so now we're stuck with just casting material, oval 8s, or splint material. And you got to try some of them to see what fits your patients. Unfortunately, it's not it's the same for everybody, right? I've done the casting with this patient. I've done the splint. The splint, actually, because of how hypermobile he is, he can kind of come out of it too much. So we decided to go ahead and try the oval 8 and see how he's doing. Already is looking pretty good. The other thing that I did that I'm not sure if I showed it on this video, but I just used a little bit of transport tape. Transport tape is harder than paper tape, and it's definitely harder than kinesio tape, and it's just a way that I can put it on and to ensure that the finger doesn't fall down. And I'm trying to teach him what to do as well, because you don't have to come to therapy very frequently for a mallet finger, but you definitely need to come to therapy for follow-up. So depending on your patient's need, you can make those recommendations. Now, for that scenario specifically, I don't need to see him for a few weeks in between, so I was teaching him a lot. For my other mallet finger, who's already with the swan neck deformity, and it's a little bit more involved, and it's a fracture with the mallet, so it's a bony mallet, she's coming in once a week because she needs a little bit more help. So it varies depending on your patient's need. So definitely take that into consideration.